Zang Fu, The Organ Systems of Traditional Chinese Medicine by Jeremy Ross. Chapter 11, Fei and Da Chang, Lungs and Large Intestine. Fei. Functions. Number 1. Roots qi and governs respiration. Number 2. Dispersing and descending function. Number 3. Moves and adjusts the water channels. Number 4. Moves the exterior of the body. Number 5. Opens into the nose, manifests in the body hair. Roots qi and governs respiration. Governs respiration. Zong qi, qi of the chest, gathers in the chest, forming a sea of qi. It is responsible for the movements of the respiration and of the heartbeat, and aids Fei in the circulation of qi and Xin in the circulation of xue. Under the influence of Zong qi, Fei governs the inhalation of the first qi of air and the exhalation of the impure qi of air. If Zong qi and Fei functions are harmonious, respiration is smooth and regular. If Fei or Zong qi are weak or obstructed, respiration is impaired and the dispersing and descending functions of Fei are affected. Rules qi. Fei is involved in both the formation and the movement of qi. As shown in figure 3.6 on page 18, gu qi, derived from food and drink by the action of pi and wei, is sent up by pi to fei, where it combines with the pure qi of air to form zong qi and zhen qi. Under the influence of Xin and Fei, Zong qi assists Fei in the movement of qi around the whole body. That is, it assists Fei in the dispersing and descending functions. If Fei is weak and the formation of movement of qi is impaired, there may be deficiency or stagnation of qi in any part of the body. Since Zong qi regulates both Fei and Xin, the relationship between the Fei function of movement of qi and the Xin function of movement of xue is very close. In addition, there is the basic relationship in which qi moves xue and xue nourishes qi. It is in this sense that Fei is said by some texts to control xue mai. Dispersing and descending functions. The dispersing and descending functions of Fei are concerned primarily with the movement of two substances, qi and jingye. Movement of the latter is topic of the next subsection. Here we are mainly concerned with the movement of qi. Dispersing function. The dispersing, disseminating or circulating function of Fei is concerned with the spreading of qi throughout the body. Chen qi, formed in Fei, has two facets, Wei qi and Yin qi. Fei assists the dispersal of Wei qi through the muscles and the skin, mainly outside of the Jingluo, and the dispersal of Yin qi throughout the body, mainly within the Jingluo, including the shuemai. The dispersing action of Fei similarly assists the spreading of Jing throughout the skin and muscles, flowing with the Wei qi, and the distribution of Ye to the Zang Fu, joints, brain, and orifices, flowing with the Yin qi. Failure of the dispersing function may lead to deficiency and stagnation of both qi and jingyue throughout the system. Descending function. Since Fei is the topmost zang, the natural direction of movement of its qi is downwards. However, there is a specific relationship between Fei and Shen, described on page 70, whereby Fei sends qi down to Shen, which receives it and holds it down. If Fei does not properly send down the qi, or if Shen fails to hold it, Qi repels upwards, impairing both the dispersing function of Fei and the proper rhythm of respiration. Also, in the cycle of Jingye, circulation shown in figure 7.2 on page 69 and discussed in the next subsection, Fei liquefies the impure fluids and sends them down to Shen for separation and excretion. Shen vaporizes a part of the Jingye it receives and sends it back up to Fei. Failure of a Fei to send down the impure Jingye from circulation results in edema and may affect the dispersing function of also. Moves and adjusts the water channels. Fei receives the pure fraction of the Jingye from P as vapor, separates them, and circulates them throughout the body. There are three main fractions going to the skin, to the body, and to Shen, respectively. The first two, purer fractions, circulate as vapor, the lighter fraction Jin to the skin and muscles, and the denser fraction Ye to the interior of the body, as previously described. Fei liquefies that part of the circulating Jingye that has become impure through use and sends it down to Shen. So the dispersing function of Fei circulates the purer fractions of the Jingye as vapor, whilst the descending function sends the impure fraction down as liquid. If the Fei functions of dispersing and descending Jingye become weak, then there may be excessive or deficient perspiration due to impairment of the dispersing of Jing and Wei Qi to the skin, and general or local edema, especially in the upper body, due to the deficiency of both the descending and the dispersing functions. Rules the exterior of the body. Fei is the topmost zang, the lid of the yin organs, and is considered the tender organ, since it is the zang in most direct contact with the external environment, and the zang most easily invaded by external disease factors. Also, Fei assists the dispersing of Wei Qi and Jin to the muscles, skin, and the surface of the body, and is responsible not only for the moistening, nourishing, and warming of the skin, but also for the regulation of respiration and resistance of the body to external factors. If Fei Qi is weak and the dispersing function deficient, the protective function of Wei Qi will be reduced, and external disease factors are more likely to enter the body. Opens into the nose, manifest in the body hair. The brilliance of Fei is said to manifest in the body hair. This is an aspect of the function of Fei to rule the exterior, since the exterior, in this context, includes skin, body hair, sweat glands, and resistance to external invasion. If Fei Qi is weak, and the skin and body hair are not properly moistened and nourished, the skin may be rough, dry and flaccid. The body hair poor and lustreless, and the pores may not open and close properly. Fei open into the nose, the pathway for respiration, via the throat, the door of Fei, and the resistance of the vocal cords. If Fei Qi is weak, and there is impairment of the respiratory, dispersing, moistening, or protective function of Fei, there may be blockage or inflammation of nose and throat, and disorders of the vocal cords. The sign of deficient Qi: low, weak voice, with a little desire to speak, relates to both the role of Fei in ruling Qi and to control by Fei of the vocal cords. Sudden loss of voice usually reflects invasion of Fei by external disease factors. Patterns of disharmony. Deficient Fei Qi. Deficient Fei Yin. Invasion of Fei by wind. Retention of phlegm in Fei. Since Fei rules Qi, it may be associated with Qi deficiency. Since Fei needs moisture for proper functioning, it is susceptible to external or internal heat or indeficiency, producing dryness. If Fei Qi is weak, failure of the dispersing function may lead to stagnation of Qi and Jingye in Fei, with accumulation of phlegm. Since Fei is closely linked to the exterior, if the dispersing function is weak and there is inadequate circulation of protective Wei Qi, Fei may be invaded by external pathogenic factors. Origins. The origins of Fei disharmonies are summarized in Figure 11.1. Fei disharmonies can be classified according to the 8 principal patterns: yin-yang, internal and external, deficiency excess, and cold heat. Firstly, yin-yang. Deficient Fei Yin may be associated with deficient Shen Yin and with deficient Yin of other Zang Fu. The tendency to phlegm accumulation may be associated with deficient Shen, Pi and Fei Yang, and possibly also with deficient Xin Yang, if Yang deficiency is severe and general, whereas deficiency of Yin is associated with heat and dryness. Deficiency of Yang in this case is associated with failure of P function of proper transformation and transportation of Jingye, and failure of Fei function of dispersing and descending. As a result, damp accumulates in Fei and may condense as phlegm. Deficient Qi, Yang and Yin are internal conditions, but they may predispose to invasion of Fei by external factors, or they may be aggravated by them. The main external factors here are wind, heat, cold, and damp, which may invade Fei in various combinations. Deficient Qi, Yang and Yin are conditions of internal deficiency. If these conditions lead to invasion of Fei by external factors, and the latter accumulate in Fei, or if the internal conditions lead to accumulation of internal damp and phlegm, the deficient conditions may turn into excess. Excess conditions may simply be caused by invasion by and retention of external factors, but usually there is a predisposing internal deficiency, enabling invasion by external factors to occur. Deficient Fei Qi. Some texts do not list the category of deficient Fei Qi, but include it in the categories of invasion of Fei by wind and retention of phlegm in Fei. There is a reciprocal reciprocal relationship between deficient Fei Qi and the invasion and retention patterns, since deficient Fei Qi may predispose these patterns, which in their turn may originate or aggravate deficient Fei Qi. In other words, the deficiency, invasion, and retention phenomena may all be part of the same pattern, which manifests different facets depending on internal and external conditions. Signs. Signs of deficient Fei Qi include weak cough, weak voice and lack of desire to talk, shortness of breath aggravated by exertion, weak respiration, asthma, copious, clear dilute sputum, fatigue, pallor, spontaneous daytime perspiration, lowered resistance to invasion by, for example, wind cold, weak pulse, and pale tongue with thin white coat. Pathology. The signs of deficient Fei Qi are almost identical to the signs of deficient Qi. This is due to the very close relationship between Fei and Qi, already discussed on page 139. The signs of weakness are due to deficiency, specifically of both Qi and Fei. The disharmonies of respiration, shortness of breath, and asthma and cough are due to the failure of the function of Fei in governing respiration and in sending down the Qi to Shen. Hence, the breathing movements are no longer strong and even, and Qi rebels upwards, causing cough and asthma. The sputum is copious and dilute, since deficient Fei Qi may be predominantly associated with deficient Fei Yang, and deficient Yang is associated with copious, clear, dilute secretions. In this case, deficiency of Fei Qi and Yang are associated with weakness of Fei function of dispersing and descending of Jingye, with accumulation of Jingye and some condensation into phlegm. Since Fei governs vocal cords, there is a weak voice and a lack of desire to talk. Since Fei governs the exterior, there may be spontaneous daytime sweats and lowered resistance to invasion, due to failure of Fei in proper dispersing of Wei Qi to the pores and the body surface. The patient may suffer from frequent colds, a manifestation of deficient Fei Qi and Yang, and deficient circulation of Wei Qi with invasion of the body by wind and cold. Treatment. This pattern is usually found in combination with others, for example, with deficient Shen and Pi, Qi and Yang, as in the deficient Yang form of pulmonary tuberculosis, or with invasion of Fei by wind and retention of phlegm in Fei, as in bronchitis. Treatment will depend on which Zang Fu are involved, and whether the condition is acute or chronic, hot or cold, external or internal. It will also depend on whether there is invasion or retention of external factors, or whether the deficient pattern has turned into excess, and on the specific needs of the patient at the time. Possible points for the common cold and for bronchitis are given on page 145 and 147. Dealing with invasion of Fei by external wind and retention of phlegm in Fei respectively. Common disease patterns. Deficient Fei Qi may be involved in bronchitis, asthma, pulmonary tuberculosis, emphysema, common cold, and allergies. Deficient Fei Yin. Signs. Signs of deficient Fei Yin may include general signs of yin deficiency, such as afternoon fever, night perspiration, hot sensation in palm and soles, malar flush, emaciation, thin rapid pulse, and wet tongue, perhaps with thin dry coat. In addition, there may be signs of dry, unproductive cough, or cough with scanty sticky sputum, which may be tinged with blood, dry itchy throat, and low hoarse voice. Pathology. The general yin deficiency signs are those of dryness and heat, and the signs of yin deficiency specific to Fei manifest as dryness and heat in the respiratory system. For example, dry throat and dry cough. If yin deficiency develops into fire in Fei, then this may damage the blood vessels and there may be hemorrhage, resulting in blood-stained sputum or in epistaxis. Treatment. The principle of treatment is to clear heat from Fei and strengthen yin of the body and of Fei. For pulmonary tuberculosis associated with deficiency of yin and hyperactivity of fire, points such as swallowing may be used with even or reducing method. Da Chui, Du14, disperse heat, reduces fever. Zang Fu, lung 1, Kong Chui, lung 6, and Fei Shu, bladder 13, are disperse fire in Fei. Geshu, bladder 17, is keeps Shui in Shui Mai. Yinshi, heart 6, eliminates heat and reduces night sweats. Shenmen, heart 7, calms Qin and Shen to reduce irritability and insomnia. Sanninjiao, spleen 6, and Tai Chi, kidney 3, nourish yin. Common disease patterns. Deficient Fei yin may be involved in chronic bronchitis, bronchiectasis, chronic pharyngitis, pulmonary tuberculosis. Dryness of Fei. Some authorities mention this minor category, often seen in some areas of China in autumn and winter when the weather is dry. This is an external pattern due to invasion of external dryness, which does not necessarily involve deficiency of yin or signs of external heat, as in deficient Fei yin. The invasion is seasonal and of short duration, with such external signs as headache and fever, and signs of dryness in Fei, such as dry nose and throat, dry cough with no or scanty sputum, and with red-tipped tongue with thin yellow coat. In the experience of the author, a similar pattern may be produced by sleeping in a room with a dry, hot atmosphere, such as that produced by storage heaters. Invasion of Fei by wind. Of all the Zang, Fei is the most sensitive to invasion by external factors, the most important of which are wind cold and wind heat, which may transform into each other. Signs. Signs of wind invasion are itchy throat, cough, headache, fever and chills, sweating, aversion to wind, and superficial pulse. If wind is associated with cold, chills are more prominent than fever. Sweating may be less or absent. In addition to aversion to wind, there is aversion to cold, and pulse is not only superficial but also tight. Also, there may be asthma, nasal obstruction, watery nasal discharge, cough with, cough with thin watery sputum, and tongue with thin white coat. If wind is associated with heat, fever is more prominent than chills, and perspiration may be increased. There may be signs of heat or dryness in Fei, such as red, sore swollen throat, asthma, full cough with yellow sticky sputum, and dry nose, perhaps with bleeding. In addition, there may be general signs of heat, such as thirst, constipation, dark urine, pulse rapid, as well as superficial, and red tongue with thin dry yellow coat. Pathology. Invasion of Fei by external wind affects the dispersing and descending functions of Fei, and hence the process of respiration in all areas of the respiratory system, with itchy throat and coughing. External wind invades the superficial part of the body with derangement of the protective qi, leading to opening the pores, sweating, aversion to wind, and superficial pulse. The headache results from invasion of the Tai-Yang channels by external wind, and the fever from the struggle between Wei Qi and external wind. The failure of Wei Qi to warm the skin and muscles lead to chills. The association of cold or heat with wind involves the additional presence of cold or heat signs, such as copious or scanty sputum, or slow or fast pulse. Both external heat and external cold may affect the dispersing and the descending function of Wei, resulting in cough, asthma, or nasal obstruction, which will be associated with signs of cold and excess fluids in the case of the wind cold, and of heat and dryness in the case of wind heat. Treatment. The common cold is an example of invasion of Fei by wind. The principle of treatment is to disperse wind and to disperse cold in the case of wind cold, or to disperse heat in the case of wind heat. Principal points such as the following may be used. Hegu, a large intestine 4, disperses wind cold and especially wind heat. In combination with Fu Liu, causes sweating to relieve external signs. Li Gu, a lung 7, lower point of Fei channel, strengthens dispersing and descending functions of Fei, disperses wind, especially wind cold, especially effective in combination with Wai Guan. Wai Guan, triple border 5, connecting point of Sanjiao and Yangwei channels, disperses external conditions, especially wind cold. 20. Gallbladder 20, intersection of Dang and Yangwei channels. And since Yangwei controls the external Yang, then Qi disperses external conditions, for example, of wind cold or wind heat, relieving headache, nasal congestion, etc. Additional points for wind cold may be added to the principal points chosen. Fanfu, Du16, eliminate wind and external signs, relieve headache. Phlegm, bladder 12. Feishu, bladder 13, strengthens dispersing and descending functions of Wei, Fei, eliminates wind and exterior signs. Fu Liu, kidney 7, with Hegu, causes sweating to aid relief of external conditions. Additional points for wind heat may be added. Xiaoshan, lung 11, prick to cause bleeding, to disperse wind heat in the Fei channel and ease the throat. Da Chui, Du14, relieves wind and external conditions, disperse heat. Qi, large intestine 11, disperses external conditions and heat. Further additional points may be added for specific conditions such as headache, nasal congestion, and so on. Reducing method is used for all points. In addition, cupping may be used on points of the upper back and neck. Common disease patterns. Invasion of Fei by wind may be involved in either acute conditions or in acute flare-ups of chronic conditions, such as common cold, pneumonia, bronchitis, asthma, tonsillitis. Retention of phlegm in Fei. P forms phlegm. Fei stores it. There is a reciprocal relationship between accumulation of phlegm and failure of dispersing function of Fei. Each may originate or aggravate the other. Phlegm is a secondary disease factor derived from internal or external dump. It may take time for phlegm to condense from dump and to accumulate. Since phlegm has a tenacious and material aspect, it gradually takes longer to accumulate and disperse than wind cold or wind heat. It is associated with conditions of obstruction, stagnation, and retention, and is a progression from dump, just as stagnant Xue is a progression from stagnant Qi. Phlegm may originate internally, associated with chronic deficiencies of qi and yang of shen, pi and fei, and, especially in this case, may be slow to disperse, since these chronic deficiencies may respond slowly to treatment. Phlegm may originate externally by invasion of fei by wind heat, wind cold, or by damp, resulting in an excess condition. This external invasion may be predisposed by internal deficiency, or external invasion may weaken fei qi, which is excess turning into deficiency. Signs. Retention of phlegm in fei includes such signs as coughing or asthma with copious sputum, water in throat, fullness of chest, perhaps loss of appetite, nausea and vomiting, slippery pulse and tongue with thick greasy coat. In addition, there may be signs of heat or cold, depending on whether the retention of phlegm dump in fei is predominantly of phlegm cold or phlegm heat. Table 11.1 Retention of phlegm dump in fei. Phlegm cold. Sputum is white. Cold or heat. Signs of cold and perhaps internal deficiency. Pulse are slippery and slow. Tongue coat are greasy and white. Phlegm heat. Sputum is yellow. Cold or heat. Signs of heat. Pulse is slippery and rapid. Tongue coat are greasy and yellow. Pathology. Phlegm obstructs the movement of qi throughout the respiratory system, impairs the dispersing and descending function of fei, and leads to the above signs. Phlegm may also obstruct the chest with coughing, fullness, and discomfort, and wei with digestive disturbance. The slippery pulse and greasy tongue coat reflect the accumulation of phlegm in the body. Predominance of heat or cold leads to predominance of signs of heat or cold. For example, feverishness with a rapid pulse and yellow tongue coat, or chillness with slow pulse and a white tongue coat. In addition, there may be signs of internal deficiency, especially of P and Fei. For example, loose stools, low voice, and weak respiration. Treatment. The principle of treatment is to strengthen the dispersing function of Fei Qi to disperse phlegm. In addition, it may be necessary to disperse wind heat, cold or damp, or to strengthen deficiency, for example, of Shen Yang and Pei Yang. Generally, even method or reducing method is used to disperse disease factors, and reinforcing method is used to strengthen deficiency, but the particular method used will depend on the situation. For bronchitis, principal points such as the following may be selected. Taiyuan, lung 9, and Fei Shu, bladder 13, strengthen Fei and disperse phlegm. Fenmen, bladder 12, and Hegu, large intestine 4. This combination eliminates wind and disperses external conditions. Fenlong, stomach 40, strengthen P and Wei to resolve phlegm. If heat predominates, points such as Da Shui, Du14, and Chu Qi, large intestine 11, may be added to disperse heat. If cold due to deficiency predominates, points such as Shenshu, bladder 23, and Pishu, bladder 20, may be used with moxa to strengthen the deficiency and enable P to transform the phlegm. For nausea, Chongwang, Renmai 12, and Nei1, precardium 6, may be added to pacify Wei, the former to help transform phlegm and the latter to open the chest. Common disease patterns. Retention of phlegm in Fei may be involved in the following diseases: chronic bronchitis, bronchial asthma, bronchiectasis. Summary. Patterns of Fei disharmony can be summarized by looking at the common sign of coughing. In true TCM, there is no symptomatic treatment of coughing. Treatment depends on the nature of the pattern of disharmony of which coughing is part, and on the particular needs of the patient. In differential diagnosis, the key questions are: what kind of cough, accompanied by what other symptoms? Acute cough with copious clear sputum indicates invasion of Fei by wind cold, and acute cough with thick yellow sputum indicates invasion of Fei by wind heat. The pulses are superficial and slow, and superficial and rapid respectively. If the pulses are deeper and the cough full and chronic, then copious white sputum may indicate retention of phlegm cold in Fei, and thick yellow sputum may indicate retention of phlegm heat in Fei. If the cough is sporadic, with sore flanks and other signs of GAN disharmony, for example, wiry pulse, it may indicate invasion of Fei by gunfire. If the cough is chronic, with exhalation easier than inhalation, and with lumbar soreness, it may indicate deficiency of Shen Qi and Shen Yang, with failure of Shen to grasp Qi. If the cough is weak, with asthma, low voice, and frequent colds, and influenza, it may indicate deficient Fei Qi. A dry cough with dry throat may indicate deficient Fei Yin, if accompanied by rapid pulse, malar flush, and other deficient Yin signs, or if accompanied by external signs and no signs of deficient Yin, may show invasion of Fei by external dryness. Figure 11.2 summarizes the different patterns of coughing, and Table 11.2 summarizes the Fei patterns of disharmony. Table 11.2 Fei patterns of disharmony. Deficient Fei Qi pattern. Signs is weak cough, weak voice, asthma, spontaneous perspiration. Pulse is weak. Tongue is pale, moist, thin white coat. Deficient Fei Yin pattern. Signs are dry, unproductive cough, malar flush, night perspiration. Pulse are thin and rapid. Tongue are red, thin dry coat. Invasion of Fei by wind cold pattern. Signs are itchy throat, acute cough with copious clear sputum, chills and aversion to cold. Pulse are superficial tight. Tongue are thin and white coat. Invasion of Fei by wind heat pattern. Signs are red, sore throat, thirst and acute, full cough with yellow sticky sputum, and fever. Pulse are superficial and rapid. Tongue are thin and yellow coat. Retention of phlegm cold in Fei pattern. Signs are cough with copious clear sputum, fullness in chest, and nausea. Pulse are sleepy and slow. Tongue is thick white greasy coat. Retention of phlegm heat in Fei pattern. Signs are cough with copious thick yellow sputum, fullness in chest. Pulse are slippery and rapid. Tongue is thick yellow greasy coat.